Welcome, everybody. We'll be beginning in about 2 minutes.
Good morning, everyone. We interrupt your regular programming as the governor addresses the state regarding Colorado's first discovered case of the COVID-19 variant, that same one that was discovered in the UK. The governor is speaking now. Let's listen in.
First to detect that variant. I fully expect that other states and state labs will also detect that in the coming weeks and months. We don't yet have a good idea of how prevalent it is, either nationally or within our state, but we'll be going to our medical experts who are joining us today. Dr. Emily Travanti, the scientific director and interim director of the State Public Health Lab, who's going to talk about their really groundbreaking work. Dr. Rachel Herlihy, the state's lead epidemiologist, and Dr. Eric France, Colorado's chief medical officer, who will discuss the new variant and what it might mean. First, a quick update on where we are in Colorado. A number of new cases today, preliminary numbers, 2,451 in Colorado, and that is with 24,000 people tested. What we've seen the last few days, perhaps because of the holidays, is the number of people tested has gone down. So we want to encourage anybody with symptoms, flu-like, cold-like symptoms, please get tested. It's much better to identify this early, prevent unnecessary risk for your loved ones, family members, and others, and to get the treatment you need if you need treatment. We currently have just over 1,000 people hospitalized in our state for coronavirus. And we also mourn the death and extend deep condolences to the families of the 3,901 Coloradans who have died from COVID. We have over 4,750 people who have died with COVID, but 3,901 that have died because of COVID. We are also at over 84,000 vaccines administered. We are and remain, I think, the top 4 or 5 states for vaccines administered per capita, per population. We're very proud of that. We want to build that lead. We want to be number 1. And as more Coloradans receive vaccines, we're nearing the point where in a few months, by late spring, early summer, the risk will be substantially lower. And as you know, throughout this process, my goal has been to save lives and to end the health crisis, which is why the limited early doses, the earliest doses of the vaccine, we prioritize the frontline healthcare workers who work closely with COVID patients across the state, the people that are needed for COVID response. And now already we've begun the residents and staff of long-term care facilities like nursing homes, where there has been a significantly higher rate of hospitalizations and deaths. Today, we are updating and entering in many parts of our state Phase 1B to more closely align with the CDC guidance and to act to save lives. Phase 1B still includes moderate risk healthcare workers, home health, hospice, dental settings, first responders, EMS, firefighters, police, correctional workers, dispatch, many of the first responders and COVID-19 response personnel that are key for the COVID-19 response. This update also includes in Phase 1B, Coloradans that are 70 and older. So again, starting today, many areas of the state are moving to 1B. Some are still in 1A doing their frontline COVID workers, hospital workers. But for those who, many areas are entering 1B, anybody 70 and up, any Coloradan 70 and up can now legally receive the vaccine. And I want to talk a little bit about the reason for that. over 78% of COVID deaths in our state are people aged 70 and older. And now people aged 70 and older will have the opportunity to begin getting vaccinated, protected in the next few days. It's likely, given the size of the 70 and up population, that this will take about 4 to 5 weeks before everyone over 70 who wants it will have gotten the first dose of the vaccine. Again, for some, it'll take 3 weeks till they get the second dose and gain the protection. The first dose might confer some protection. So we're starting that today, given the supply expected, obviously everything's dependent on what we get from the federal government. But we're expecting that all Coloradans 70 and up, starting this week, will be able to complete that vaccination of 70 and up in the next 4 to 5 weeks for that first dose. The phase also, while Coloradans 70 and up are receiving vaccinations, we're also working with different employers to do targeted programs for essential frontline workers, continuity of state government, educators, teachers, food and ag workers, U.S. Postal Service, public transit, grocery workers, essentially the CDC list. We've added frontline journalists, a few hundred people that are out sharing knowledge with people in the field, risking potential exposure to that, and also direct care providers for Coloradans experiencing homelessness also to this phase 1B. So those are not, these are not mass groups. So 70 and up is a mass group. That means you're 70 and up, you can get it. Obviously, it depends when it's available in your hospital, in a drive-through clinic. Some areas of the state are still finishing up 1A for another week and before they move on to 1B. For a lot of these other groups that we're talking about, teachers, food and ag workers, we will be scheduling with the county health departments, with other providers, largely employment-based, site-based clinics for that. Could be, mid-February, could be the date for you if you work at this Safeway is, February 15th. It could be if you are, for RTD, you'll have a date, it'll be coordinated where you can get it. And it might be, February 26th. So those will be specific dates for specific workers in a convenient way. But the sort of large group of the population that is now able to get it in many parts of our state, and then as I said, some are finishing up 1A and going to 1B, is if you're 70 and up, you can legally get it. It depends on supply in your area. We will work to hopefully cover everybody 70 and up who wants it. And let me just add, if you're 70 and up, you really, 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 really should want it. And why we prioritize 70 and up, and I think you've probably seen this anecdotally, but I want you to see the cold hard facts. The likelihood, if you can track the virus of this causing death, is 500 times what it is for somebody in their early 20s. And while we lose people of all ages, 78% of those who we've lost to coronavirus are over age 70. So once we get through this 5-week period, a few more weeks for the second dose for some people that get it towards the tail end, we really have the opportunity to reduce coronavirus deaths by almost 80% in our state, and a similar decline in hospitalizations. That would end the crisis phase. Pandemic not over, people of all other ages still getting it, some still dying, some still being hospitalized, but we will no longer have that immense pressure on our hospitalizations. And just imagine for a moment here, while we've lost 3,900 people, imagine if it was a number 80% less. Still a tragedy, still pandemic, but we can make a lot of progress towards ending that healthcare crisis piece as we complete the vaccination of everybody 70 and up in the next 4 or 5 weeks. Phase 2 includes Coloradans that are 60 to 69, and also high-risk Coloradans that are 16 to 59. That means people with pre-existing conditions. There'll be more details about that later, but there's a set of pre-existing conditions that the CDC puts out. It'll be the equivalent of having, a doctor's note. You have, for instance, diabetes, you're 28, you're at a higher risk. But all Coloradans 60 to 69 for phase 2, and anybody 16 to 59 with pre-existing conditions. A little point on that might be extended to age 12 to 59. There's currently clinical trials for 12 and up. It's not approved for 12 and up yet, but that could happen at some point. Currently, it's age 16 and up. With these updates, all depending on the steady supply of vaccines from the federal government, we're anticipating that we'll get through phase 1 in spring, phase 2 by late spring, early summer, and then the general population in summer. And that's everybody who doesn't fall into one of those categories. It remains critical that any frontline healthcare workers in 1A who have not received the vaccine sign up and get vaccinated. There are some areas of the state where 1A has not yet been completed, is being completed in the next few days. We will continue reviewing any guidance from the CDC, update these phases accordingly. And I'm really looking forward to the day where everyone who wants a vaccine can get it, and we can embrace our loved ones again, celebrate life's special moments with one another, starting with our age 70 and up Coloradans who are at greatest risk of hospitalization and death for this virus. The vaccine is now available legally to everyone age 70 and up in your area. Again, they might still be completing the healthcare workers, and that could take a few more days, but in some areas of the state, that is beginning right away. The second thing to talk about today, and we have our top experts here, and there's a lot of national and international interest in this. Scientists in our state identified the first confirmed case of the COVID-19 variant, the UK variant, in Colorado. The individual is a man in his 20s who is working in Simla, not recently traveled. He's currently recovering in isolation, mild symptoms. Our public health officials are working diligently to identify anyone else who may have been exposed and any other potential cases to test them to see if there's a chain of transmission with regard to the variant. And as I said, this is unlikely to be the first person with the variant here in the United States. There are likely many, particularly in northeastern United States. But I'm proud that we detected it here in Colorado as quickly as we did. It speaks to the incredible work of the exceptional scientists and staff in our state lab, like Dr. Emily Travanti, who's here with us today. I want to thank them for their commitment to helping keep Coloradans safe, to really increase testing capacity, the sophisticated system they put in place. There's a lot we don't know about this variant. And scientists here in Colorado, and of course in the United Kingdom, are studying and monitoring exactly how transmission works with this variant. It's not uncommon for a virus to mutate or change. In fact, COVID-19 has had many, many, many mutations. There has not been suspicions that other mutations have led to differences in transmission rates, but there are many, many transmissions out there. And early evidence seems to show from the United Kingdom that this particular mutation might spread more quickly. But at this time, there's nothing that indicates that this would cause different or more severe symptoms. But if it does transmit more quickly, obviously, if more people get it, it means more people hospitalized. The CDC and scientists in England, where this variant is at least first detected, believed to originate, continue to emphasize that it's the very same things that we need to do to slow the spread of the virus. Wearing a mask, staying 6 feet from others, avoiding gatherings with those outside your home, and washing your hands regularly with soap and water. If the data shows a mask is about 50 to 75% effective. As we talk about the vaccine, 95% effective, we have a very easy, simple, low cost, 50 to 75% effective vaccine today. It's called a mask. Wear one. And if in fact this variant turns out to be more transmissible, it doesn't mean masks don't work. It means that masks might be 40% effective instead of 50 to 75. Still, a effective way to reduce the spread of the virus and protect yourselves. Stay at least 6 feet from others. Avoid gatherings outside your home. I'm going to turn it over to Dr. Emily Travanti, the scientific director of the State Public Health Lab, to talk about really the world-class work being done in Colorado State Lab. A lot of focus internationally on us being the first to find this variant, and she's going to talk about how they did it. I want to thank Dr. Travanti and her team for their work to identify the strain first right here in Colorado State Lab. Dr. Travanti.
Thank you, Governor. I'm pleased to be here today to fill everyone in on how we found the B117 variant here at the state laboratory. At the state lab, in addition to processing testing, we are constantly studying the virus, keeping apace with scientific discoveries as we continue to learn about this novel virus. We've been tracking the B117 variant of this virus since it was first discovered in the UK earlier this month, around December 20th. We followed as the variant rapidly became the predominant strain circulating in parts of their country. When we say that the variant was detected, we mean that a new version of this virus has been identified. It has a distinct molecular signature or specific sequence in the spike or S gene. The process for discovering the variant started by doing our regular COVID-19 diagnostic test, the PCR test that many Coloradoans get by having a nasal swab sample collected. This routine test looks for the presence of 3 COVID-19 genes in a patient sample. Typically, if we find those genes, we know the patient is COVID-19 positive. A positive result for COVID-19 infection occurs when at least 2 out of 3 of these genes are found in a patient sample. The viral genes used in this test are the N gene, or nucleocapsid, ORF1AB, open reading frame 1AB, and the S, or spike gene. When testing a sample of the B117 variant, only 2 of the 3 genes are found, the N gene and the ORF1AB gene. The presence of these 2 genes in the sample does tell us that the sample is positive for COVID-19. Things get really interesting, though, when we start talking about that 3rd gene, the S gene. The S gene is there in these samples, but it is a mutation. It makes it typically undetectable by the routine PCR assay. We call this the S dropout profile. It is a signature marker of this variant. Upon learning of the novel B117 variant, first detected in the UK, the associated mutation in the S gene, the state laboratory set up a screen to capture samples in which the N gene and the ORF1AB targets were detected, but for which there was no signal for the S gene target. Samples meeting this so-called S dropout profile are red flagged, and we know that this means that we need to do more investigation on these samples because it could possibly be this new variant. To investigate further, we do viral genome sequencing. We look at the entire COVID-19 virus genome using next-generation sequencing technology to create a complete fingerprint of the viral RNA found in the individual patient sample. The state laboratory has a well-established genome sequencing program that uses a number of advanced molecular detection techniques. We combine this lab information with information from our epidemiologists to help determine the origin of outbreaks and inform public health action. In the case of COVID-19, the state lab is using sequence to track the movement of COVID-19 across the state and throughout the pandemic. At the state lab, we are committed to conducting genome sequencing on all samples with the so-called S dropout profile to determine how widespread this variant may be in our state. To date, we've conducted sequencing on 24 of these suspicious samples, and our scientists have found 2 samples that contain mutations in the S gene. Another 12 samples are currently in line for sequencing at the laboratory, and CDPHE continues to look back at older samples as well as all samples moving forward for indicators of these mutations. The B117 variant samples that we were able to confirm with the CDC was from a patient that had a positive result in this initial screen diagnostic PCR test with a strong signal as indicated by low CT or cycle threshold values of 12 to 13 for both the N gene and the ORF1AB gene. Upon genome sequencing, it was found to have 7 key signature mutations associated with the B117 variant, first reported in the UK. These mutations include a signature or missing piece in the S dropout profile, as well as 6 changes that impact the structure of the S protein. Additionally, a second sample, which is highly suspicious but has not yet been confirmed, was also positive by diagnostic PCR testing with CT values for the N gene and ORF1A in the low 20s. Initial sequence analysis on this second sample shows most of the same mutations associated with the B117 variant, but we're still working to complete analysis on this sample. I understand that news of the variant is concerning to many of us, but thanks to the advanced sequencing processes we have put in place, the Colorado State Public Health Laboratory was able to quickly detect this first example of B117 variant in the US, positioning us to take swift action. We are proud to be able to provide this critical scientific information to help the state make informed decisions. We know that understanding the types of COVID-19 present in our state will help inform the public health measures used to control the spread of this virus. I now pass it back to Governor Polis.
Thank you, Dr. Tavanti, and I also want to just acknowledge your work at the state lab. Last I checked, you're in the 80 to 90% of tests processed in one day. So congratulations, and even outperforming many of our private contractors as well. We are generally across the state somewhere in the 60 to 70% in one day. The rest take 2 days, and then there's a few contractors in a few parts of the state where it might take as many as 3. But the state lab is leading the pack. So you're over 80% one-day turnaround on testing, and you're one of our biggest processors of testing. So thanks for that work. And somehow, amongst doing all that testing, you also had time to look for new variants. So thank you for that groundbreaking work. I want to turn it over to Dr. Rachel Herlihy, our state's lead epidemiologist, to give us more information on what we know about the variant's presence in Colorado. And an update on the epidemiological response. Dr. Herlihy.
Good morning. Thank you, Governor. So our investigation and contact tracing efforts are ongoing, but at this time we are aware of one confirmed and another possible case with the B117 variant of the virus, as described by Dr. Travanti. Both of these cases are Colorado National Guard personnel who were deployed to support staffing at the Good Samaritan Society nursing home in Simla, Colorado. That's in Elbert County. Their deployment at the facility began on December 23rd. The nursing home has an ongoing outbreak of COVID-19. Cases of COVID-19 were first identified in the facility in mid-December, following routine surveillance testing in that facility. As part of their deployment to support facilities like this that are having staffing shortages due to COVID-19 outbreaks, National Guard personnel are routinely tested for COVID-19. These individuals were tested on December 24th, and that testing was performed at the state lab. And that is really how our lab came to acquire these specimens and do this testing that Dr. Travanti described. So right now, we are currently investigating 2 possibilities for how these individuals may have acquired their infections. First, the National Guard personnel could have acquired their infections while working at the Simla facility. We'll talk more about that in just a second. And second, the personnel could have acquired their infection through other work or personal activities prior to arriving at the facility. Neither of these cases has traveled internationally in the weeks prior to their illness. So for that first scenario, we have detailed case investigation and contact tracing activities occurring at the Simla facility. To date, 20 of 34 regular, so non-National Guard staff in that facility, and 26 of 26 residents in the facility have tested positive for COVID-19. 4 deaths have been reported among residents. The testing on these individuals was performed at a different laboratory, so not at our state lab. Therefore, to determine if B117 variant is circulating in the facility beyond these 2 individuals that work for the National Guard, we have deployed a team to the facility. That was done yesterday to collect specimens from staff and residents in that facility. Additional testing will be performed today. So specimens were collected and are being tested at the state laboratory. We do have some preliminary results from that testing from specimens that were collected yesterday. And so far, based on the testing that has been performed in that facility, we do not have evidence that the variant virus is circulating in that facility, but testing is ongoing. We have additional individual specimens that will be tested today and additional specimens that will be collected later today from the facility. I think it's also important to note that the National Guard personnel didn't arrive at the facility until December 23rd, and that was really long after most of the cases associated with the outbreak have occurred. Therefore, we're also looking into the second possibility, which is the possibility that exposure happened outside of the Simla facility. We have an extensive investigation underway to identify all contacts the cases may have had in the 2 weeks leading up to their deployment, as well as any other contacts outside of the facility they may have had during their deployment. That investigation is ongoing, and we are exploring all possibilities. To slow the potential spread of this variant, the cases will be ordered to isolate for 10 days from their symptom onset or collection date. Daily isolation monitoring will be conducted by our epidemiologists. The confirmed case is now isolating at home in Arapahoe County, and the other possible case is isolating at a hotel in Lincoln County. In addition, all identified contacts of these potential cases, or this confirmed and possible case, will be ordered to quarantine for 14 days from their last exposure, with testing being performed on days 5, 10, and 14. Daily quarantine monitoring will also be conducted. Now I'll turn it back to Governor Polis.
Thank you so much, Dr. Herlihy. Thanks for updating us on the ongoing investigation. As Dr. Herlihy mentioned, it's being thoroughly investigated. We expect there'll be additional information in the next few days. I'm going to now turn it over to our Chief Medical Officer for the state of Colorado to answer questions that a lot of Coloradans have. What does this mean? What do we know about the variant? What don't we know about the variant? What do we need to do to stay healthy and keep those around us who we care about healthy? What does it mean for the vaccine that we're all so eager to get? Thank you for joining us, Dr. Franz, Chief Medical Officer for the state of Colorado.
Thank you, Governor, and good morning. Of course, thanks, Emily and Rachel, for your strong work in identifying. Good morning, everybody. Thank you. I hope you can hear me now, and just thank you all for being here this morning and for Rachel and Emily's hard work to identify and now mitigate the potential spread of a new variant. This variant, as you know, has been found in the United Kingdom. It first appeared in end of September. And it was noted in the southeast part of England that the number of cases was rising quickly in that part of the country. And on further investigation, they found that this new variant seemed to be the dominant form of the COVID virus in that community. From there, they have concluded that this new variant can be transmitted more quickly and more highly. Indeed, estimates of 50 to 70% increased transmission with this new variant. So what does that mean for us? Well, if you get COVID, of course, you can be without symptoms. 40% of people have no symptoms, or you can have symptoms of fever, a cough, and it's the same with this new variant. But it does potentially have the risk of spreading more. So if you're ill, instead of only making 2 or 3 other people sick, you might actually spread it to 4 or 5 people if it's more transmissible. If it's more transmissible, that means that we'll have more cases in our communities. Those community number of cases will rise quickly. And of course, with more cases come more hospitalizations, more ICU beds being filled, and the potential of overwhelming our healthcare system. Imagine, too, if a more transmissible form of COVID is in a nursing home. That means that it might spread more quickly within that nursing home and cause more people ill before we have a chance to get things under control. And what a tragedy that would be when we're just weeks away from vaccinating people who live in nursing homes. Now, if the other thing we're hearing, of course, is that this variant of COVID doesn't seem to be more deadly. So if you get it, you could be asymptomatic with it. You could have symptoms with it. You might be hospitalized or need specialty care, but at the same rate as the old COVID virus. So it doesn't seem like it's more deadly. The worry, of course, is that if it's spreading faster and more people have it, even with just the regular rates of hospitalizations, this could be overwhelming for our healthcare systems. So I think it would be particularly sad at this time in the pandemic when we're working so hard at getting vaccinations in arms and expanding our end game to see the end of this pandemic, to find ourselves in a place where these cases are rising again. That means all of us, as the governor has said, must do our part. We must wear our masks, stay 6 feet apart, stay within our households, particularly over this New Year season. We need to be aggressive with vaccination, following our prioritization as described today. It appears that this vaccine, we estimate, will be just as effective for the new variant as it was with the old. We'll learn more from the scientific work underway. But for now, I think we should continue the hard work of staying safe as part of our preparation of the ending months for this pandemic, doing what we know we need to do to stay safe, and stepping up and being vaccinated. The larger number of people that become vaccinated, the quicker we'll have herd immunity and will control the pandemic. Thank you, Governor.
Thank you, Dr. Franz, for sharing how this can impact Coloradans. And because the virus, as we know, can tear through nursing homes and cause immense loss, many nursing homes lost 10, 20% of their residents over a period of weeks, higher risk of experiencing severe symptoms. We're requesting today, given the detection of the variant in Colorado, that the Centers for Medicare and Medicaid Services, CMS, allow us to temporarily pause visitation for nursing homes for the time being, so that population can be vaccinated quickly. That's already happening in nursing homes, but then, in a month or two, when that population is immune, they can finally, it's been so hard for people of all ages, right? I mean, the economic pain is felt by young people. But not only is the health risk felt more acutely by older Coloradans, but the social isolation, the difficult emotional, social piece that so many residents of nursing homes have faced. After that vaccination already occurring, immunity a month later, a month or two, finally, going out again, going to malls, all those things, but poker nights, all the social aspects after the vaccination is complete. But for now, we want to vaccinate that population as quickly as possible. Older Coloradans in nursing homes, it's already started. And we're requesting that CMS pause the visitation until we have that immunity very soon, and then a lot more of those social activities that make life worth living. I also want to give a special thank you to Colorado National Guard members. From the beginning of this pandemic, they put themselves in harm's way to serve communities, protect the health and safety of Coloradans. They've helped set up and staff COVID-19 testing centers around the state. They've coordinated mask and gown storage. They've delivering vaccines. They're on the front lines every day. And in Simla, the members were deployed to help the staff the facility during an outbreak where 100% of the residents of the facility tested positive. And the person that contracted the variant ultimately ended up contracting the virus, not necessarily connected with the facility, the timing, as we indicated, likely earlier. There was already the outbreak there. We are doing additional testing. This new variant is just another reminder that there is a lot that we don't know about the virus, but there's also a lot we do know, namely how you can avoid getting it and increase your chances of not contracting the virus. Avoiding social interactions with people outside your home, keeping a distance of 6 feet, wearing a mask around others. And as vaccines work their way into Colorado, it doesn't mean life is back to normal yet. In fact, even the first Coloradans that received the vaccine still are not immune to coronavirus. It'll be another 2 weeks. They will be getting the very first Coloradans who got the vaccine, those very first, COVID ward workers, even they are not immune yet. They will get another dose in a week or so, and then they will be immune in about 2 or 3 weeks, those very first Coloradans who got the dose. So this is the home stretch, the last leg of the marathon. People 70 and up can get the vaccine. We hope to complete within 4 to 5 weeks the first dose of the vaccine for 70 and up. Once the immunity takes hold, that's another few weeks after that. We hope that there's a decrease in fatality. About 78% of those we've lost in our state to the virus have been over age 70. So the last thing we want to do, here we are, we're ending the marathon. And, I like baseball. We're rounding third base. Here we go for football. We're on the 2-yard line. Let's finish the game. Let's finish the race. The last thing we want to do is trip and fall before we reach the end. And there's a lot of temptation. There's a holiday called New Year's coming up. And I want Coloradans to see 2020 in the rearview mirror. But we want to make sure we celebrate with our own households in this very different new year. And what we don't want is large parties and events that could jeopardize your life and your loved ones. It could set the state back by weeks. You will be able to enjoy that after you've been vaccinated. It's really, the end is in sight. So avoid parties, indoor get-togethers with people you don't live with. Celebrate this New Year's differently with loved ones at home. Find alternative ways to ring in 2021 with families and friends using technology. You can watch the ball drop together online. You can go outside if there's snow and make snowmen or snow angels at midnight. That's what I used to do. We used to pass our New Year's in Vail when I was growing up, from age 6 to 26, but as a teenager. So what we do is we'd wait until midnight every year, and then we would me and the kids and the cousins would all go out to see who would be the first sledder of the new year. We want to see who would sled first at 12:01 a.m. So I was proud to say I'm the first person to sled in 89, 91, and 92. First person to sled in those years. In other years, I was beat out by cousins and friends. But look, however you celebrate New Year's, do it with those you live with. Be safe. We're nearing the end of this, and together we can get through it. This is really our last big hurdle. If we can get through this without a spike, we're setting ourselves up for a strong recovery, health, economy in 2021. And I want to say thank you, Colorado, for your resilience, for wearing masks, for your sacrifice, for your optimism, for your determination to get through this, your generosity to one another. It's not been easy, but you're what makes our state so great. So be safe. Have a happy and fun new year in a way that you can do it in a safe way. And we're happy to take questions.
Hi, this is Erin Prater with the Gazette in Colorado Springs and Denver. Just a few questions, if you don't mind. The first is I just wanted to firm up. I believe it was said that we had one confirmed case of the mutation and one possible, but it was also said that the mutation had been found twice. So I just wanted to see if we make sure that we had one confirmed and one possible, or see if we have two confirmed. Also, given that this new mutation is more transmissible, are current precautions enough and are current dial levels enough? And also, is there any update on trials of the vaccine for kids younger than 12? Thank you.
Let's go to Dr. France and probably Dr. Herlihy to address part of that. Dr. Herlihy first.
Yeah, this is Rachel. I can take that first question. So we have one confirmed and one possible case of the variant in the state right now.
And Dr. France, any updates on the additional trials?
Yeah, and regarding what we might be doing about transmissibility, you said, and does it have an impact on the dials? Really what this just means is that we'll be keeping a close eye on the cases and the number of cases every day. If the variant becomes a dominant form of COVID in the state and indeed is more transmissible, we'll see a steeper uptick, incline of cases as times go by, and we'll need to react more quickly to help control it. And so right now we're in this good place where cases have been stable and down. And if we can stay in that space, then we'll be fine. The issue, of course, will be if we start seeing cases come up and if our own sequencing finds that this is being driven by the variant, then we'll have to maybe act quicker and more broadly in our thinking. I don't have any other new updates when it comes to the trial itself for children at this point, but we would expect not to really have much information on the use of the vaccine for children until at least this summer.
And the step the state is taking today is we
Alrighty, you have been listening for the better part of the last hour to the update for the COVID-19 response here in Colorado. Really briefly, two big things were addressed during this hour. And starting with that'd be about 84,000 vaccines have been
and visitation. Sorry, go ahead.
I'm sorry. Good morning, Governor. It's David Clue at Denver 7. With everything that we've just heard, do you see this new variant as a game changer for your approach to containing the virus? And also, are you getting any indication that this will push the federal government to prioritize Colorado more for additional vaccine doses?
So as Dr. France indicated, we are looking at case numbers, right? And so we will react to case numbers, and it's really the same precautions that Coloradans need to take to avoid any of the variants of coronavirus. As I said, if it turns out this new variant is more contagious, it might mean that a mask is, 40% instead of 55% effective, but still all the same precautions need to be taken. People should just be more diligent about taking those precautions as we find out how prevalent this strain is in Colorado, forthcoming information in the following days and weeks. But we monitor case numbers every day, every moment. Hospitalizations, we're just over 1,000 Coloradans hospitalized from COVID. Our North Star is not exceeding our hospital capacity in our state. That'll be helped significantly as we inoculate everybody age 70 and up in the next 4 to 5 weeks.
Thank you, Governor. Charles Ashby from the Grand Junction Daily Sentinel. A couple of questions. Now, you've greatly expanded the number of people who qualify for a vaccine in 1B. Given what President-elect Joe Biden said yesterday about the number of vaccinations and being doled out to the states, are you confident there's enough or will be enough to cover all those people? And for the scientists, how worried are you about this variant mutating again and becoming a full-blown strain? And what conditions would it take for that to happen?
There remains some lack of stability in the federal supply, and certainly some uncertainty there. But from what we know today and what we expect from our federal partners, we believe that it'll take about 4 to 5 weeks for everybody age 70 and up to receive their first dose of the coronavirus vaccine. It's certainly possible supplies could increase or decrease, but from our best projections now, that's the expected timeline. Dr. France?
Thank you, and I'd be happy to have Dr. Travanti jump in as well. Those scientists who specialize in viruses and their normal mutations tell us that it's usually a slow process, and that if we were to be concerned that there was a mismatch between a vaccine and the current virus, that would take usually a number of years before it was a problem. And so at this point, I say we have time to learn more, understand the science, and I think it's good news that some of these newer vaccine platforms, the messenger RNA platform, can be quickly swapped out, one piece of genetic material for another, at least from the time perspective of what it takes to make a vaccine. And so our ability in the next year to make changes to the vaccine, if needed, is there. But we won't really know that for months to years.
Let me also add that the vaccine is free and there is no copay. So if anybody is trying to charge you for what they say is a vaccine, the chances are that is not a vaccine. We want to avoid any problems with a black market or false product before they even begin. That's not been reported yet, but I want to encourage, if anybody's trying to charge you, that is not the real deal. It is free. There is no copay. If you're 70 and up, you can ask for availability at your local hospital or community health clinic. They might still be in your area working through 1A, but they will be getting to 1B at some point very soon in the next few days.
I can also add really briefly that, we know viruses constantly change over time, and we expect more mutations to happen with this virus. New variants have been popping up throughout the whole course of this pandemic. Some pop up and disappear without even being detected. And we expect, this to keep happening, and there's no necessary reason at this point to think that this one is any more concerning than another variant that may arise, and we will continue to perform this sequencing surveillance at the state laboratory to keep an eye on how this virus is changing as the pandemic continues to unfold.
Hi, this is Mary Ann Goodwin with Colorado Politics. My first question is about the situation at Good Samaritan. The two National Guard troops who have been tested, were they the only National Guard personnel at that facility? And is there a possibility that the one who's back in El Paso County could be bringing back to a National Guard facility there? My second question is how many vaccine doses the state is in line for, and how that compares to the populations in the 1A, 1B, and phase 2 groups.
So I think Dr. Herlihy, do you want to take that question on the National Guard?
Sure. So a total of 6 National Guard personnel responded and have been deployed to that facility. 2 of them have tested positive. One is a confirmed case of the variant. The other is a possible case of the variant. So at this time, we do not have other members of the National Guard that have tested positive. As I mentioned, case investigation and contact tracing is ongoing. And so any close contacts of those cases will be issued quarantine orders and will be placed in quarantine for 14 days.
Secondly, Marianne, we only know for sure what we receive in our state, and we're happy to share those numbers. That's a different team of experts, but Scott Bookman has those. We have projections for future weeks, and everything we're talking about in terms of timeline depends on those projections actually being a reality of what we're getting each week. So when we're talking 4 to 5 weeks for everyone age 70 and up to have the opportunity to get the vaccine, that depends on our projections of the supply being met with the actual supply. We hope that happens, but it's certainly possible there could be logistical breakdowns at the federal level. It's also possible that there could be faster delivery. So there's some unknowns there that are out of our control about when we receive it in our state. But we always report on what we receive in state. We are working on there is a vaccine dashboard. We're working on a new vaccine dashboard with even more information that'll be updated dynamically in real time.
Thank you.
Hey, Governor, this is Jesse at the Colorado Sun. 2 questions for you guys. The first one's probably for Ms. Travanti. How long does it actually take to do that RNA sequencing to identify whether or not the variant is in what somebody tested positive for. And I'm wondering if you guys can just talk about how prevalent you think the disease is. I know it's impossible to say, but obviously someone who didn't travel has it, so it's clearly in Colorado. And then the other question is probably for the governor. Some counties are vaccinating people who are 75 and up starting tomorrow, but you're talking about 70 and up. So I'm wondering if you can talk about where that discrepancy is.
So I can address the first part of your question. So you were asking about, how long it takes to identify this mutation. So the first step is to actually just do the diagnostic PCR, and that is sort of dependent on the number of samples that we get in and how fast a lab can turn them around. Currently, the state laboratory is running a turnaround time just over a day on samples as they come in the door. So once we identify a candidate for sequencing, that process is a little bit longer and can take 3 to 5 days to generate all of the data necessary, because we look at every position in the entire viral genome and compare it to known sequences across the country, as well as what's been circulating in Colorado, in order to determine whether or not it is one of these variants or has any other mutations in it. And we're going to continue to do this sort of deep sequencing on isolates from Colorado. We have a process set up to flag these S dropout mutations to keep looking at this particular mutation, but then we also want to make sure that we are aware of any other mutations that are happening and able to trace those. So we are currently sequencing a subset of all the samples that come through the state lab, and we're also working with CDC on their national surveillance at the sequence level for COVID-19.
On the second question, we expect that counties will be amending their prioritization to reflect the state prioritization, which is 70 and up. Certainly some providers might want to focus on their older populations first in their 80s, but it should be available and people shouldn't be turned away if the vaccine is there if they are 70 and up.
Hi, Governor. This is Allie Levine from 9 News. Thanks for your time today. So you and other health officials have said we need to do the very same things to contain the spread of the virus, even with this mutation. But what is it about this variant that makes it more contagious? Is that something we know yet? For example, does it spread the same way? And second, can you give an explanation or reasoning behind this new expansion of vaccine priority? What changed?
So I think the first one would be for Dr. France, and then I'll take the second one.
So it's a great question. It's a question that people are still trying to tease out. And so at this point, it's mostly ideas. And we note that one of these mutations is happening on a part of the virus that essentially binds to the cell. So I have this little black ball. Let's assume that's the virus, and this paperclip is sitting here, and somehow it needs to stick onto the cell surface. If there's a mutation here on this piece here, all of a sudden it might stick better on the surface and then be incorporated. So if that's the case, it may take fewer virus particles for a given person to become sick, and any given virus will have a better chance of causing an infection. It's a theory at this point, but it certainly makes sense based on where the mutation is on this virus spike, that it could be explained that it's more prone to stick and cause that infection. So we'll learn more, I think, over time as scientists trying to understand why this variant might be more infectious.
So we are really implementing the CDC guidance here in Colorado. Now, the CDC said 75 and up, but they also provided the discretion for states to dig into their own data. When we really dug down and found that 78% of the fatalities from COVID-19 were 70 and up, we wanted to target that larger group initially to reduce fatalities by 78%. And then we expanded the 65 and up group to 60 to 69 for that second prioritization in phase 2. That represents close to half of the remaining fatalities. So you got the 78%, that leaves 22%. And then when we get the 60 to 69s, that's another 10%. You're still left with, of course, people that can die from coronavirus of all ages. We were reminded of that when a young 41-year-old congressman-elect from Louisiana tragically lost his life and left his wife and kids behind before being able to be sworn in. But certainly we wanted to focus our vaccine on where it could make the biggest difference in saving lives and ending the crisis part of the pandemic, which is around hospital capacity.
Hello, Governor. Jesús Carrasquel from Noticias Univisión, Colorado. Gobernador, en español, ¿qué puede decirnos sobre el primer caso de la variante del COVID-19 y también del segundo identificado? Y si aumentará las restricciones en el estado y cuál sería el proceso de vacunación.
Sí, el virus es casi el mismo. No es muy diferente, pero es más fácil obtenerlo, desafortunadamente. Esta nueva variante que lo sabemos ahora es que parece ser más transmisible que el actual virus normal, COVID-19. Se propaga entre un 55% más, lo podríamos ver que los casos crezcan a un ritmo más rápido. Pero no parece ser más mortal que el virus actual, pero es más fácil obtenerlo. Sin embargo, sabemos que nuestros estudiantes de la tercera edad corren un riesgo más alto y de vivo, pero para todos, las mismas cosas que necesitamos hacer, usar tapabocas, tener una distancia de 6 pies o más y pasar tiempo con personas que viven en su mismo casa, mismo techo.
Hi, this is Kate Taylor from the New York Times. First, could you confirm that the two individuals, the confirmed case and the possible case of the variant, are men? And secondly, what will it take to confirm whether the second case is in fact an instance of the variant? What do you have to do at this point?
So, Dr. Hurley on the first one.
Yeah, so at this point, to protect the identity of these individuals, we are not releasing their sex.
And on the second point, in order to determine if the second sample is truly a variant, we need to complete sequence of the entire genome. And right now we don't have complete coverage with the data that we have. It's actively under investigation in the laboratory. And we're hopeful that we will be able to close that gap and be able to understand all of the potential mutations that are part of this and see if it really is an example of the B117 variant.
And what's your time frame for that, Emily?
We anticipate the time frame to be within the next week to have the answer for that. This particular sample was a little bit less strong signal, so it's taking a little bit more work to pull out the sequence from the patient sample.
Hi, this is Colleen Slovin with the Associated Press. I also had a question about the sequencing. Have you ruled out the variant in the other 22 suspected samples that were sequenced? And what does that denominator tell us about how rare or how common this variant is?
So I can take that question. We have ruled out the variant in the other cases. At this point, we don't have any evidence that they are showing the signature mutations that are defined in the B117 variant. I can't necessarily say that all of the sequencing data that we have at the state laboratory can tell us everything that's going on in the state because we don't see every sample in the state. We just see a subset of the samples. And so we're going to continue to use our screen to detect any sample that has the S knockout profile and immediately direct that to sequencing, as well as continue our surveillance of other samples to get a feel for what's happening across the state.
Hi, it's Jessica with the Denver Post. Can you talk a little bit more about the decision to broaden this first phase of vaccine distribution, and if the presence of the variant is, driving that decision?
So no, yeah, the decision was actually announced today, but made prior to the identification of the variant, which was just yesterday. So this is something that we've been working on for several days since the CDC issued their guidance of 75 and up. We pulled the data and found that 78% of the deaths in Colorado were age 70 and up. And so to end the acute phase of the crisis, the potential for overrunning our hospitals, bring the death rate down, saving lives, ending the pandemic, we wanted to focus those initial doses on age 70 and up.
Governor, Steve Steger from 9 News. So 2 questions. This new vaccine priority, it puts journalists and government leaders ahead of people who might have potential comorbidities and be more at risk for the virus. You're working from home. I'm working from home. I'm just wondering why that's the case. And second question, a Republican Party leader in Douglas County recently launched a campaign to publish home addresses of public health workers. Obviously, that's a clear threat. Public health employees have faced threats throughout this pandemic. Is there anything that the state can do about that?
Let me do the second one first. Obviously, we want to encourage, I want to, on behalf of the state of Colorado, I want to discourage any form of doxing in people's personal lives or because of political vendettas or for any reason. And we absolutely value the work of our public health officials who have really been working extraordinarily hard during the first pandemic in a century to prevent additional loss of life. In terms of the categorization, so the way that it applies first to journalists is it's to field journalists. So it shouldn't be there'll be discussions with the news organizations, but if you are working from home, you would not be in the priority group. We also know that there are cameramen and field journalists that by nature of what they do, a critical service in a democracy, providing coverage and news and information. They, as part of the critical aspect of a coronavirus response, need to be protected. So it's not everybody that works for a news organization, it's frontline journalists that are in the field. We also value continuity of government. That was identified also by the CDC for the coronavirus response. We need a legislature, we need our officers. This is a critical part of the coronavirus response because it is the funding mechanism for the entire coronavirus response, those that are in positions that are absolutely critical for the response. And so that is also a critical piece of a successful response to the pandemic to end it as soon as possible.
Hello, Governor. This is Vinny Del Giudice at Bloomberg News in Denver. 3 questions regarding the federal response. What contact has Colorado had with the CDC since its discovery? Is the federal government sending additional resources for screening and sequencing? And finally, number 3, is Colorado working with the federal government in other ways to escalate the response? Thank you very much.
There's been a lot of coordination with CDC, and they were involved with the announcement, and obviously they knew that somewhere it would be discovered. They were very complimentary of our efforts. And in terms of the exact coordination, I'll turn it over to, I think, Dr. Travanti. Do you want to talk about how we work with CDC on this?
Absolutely. We work very closely with CDC's, all of CDC, and especially their branch of advanced molecular detection in setting up our sequencing profiles, protocols we use in the lab, as well as our bioinformatic pipelines, which are the computational computer and algorithms that we use to analyze the data. We shared our data with CDC. They were one of the first contacts that we made, and they all felt that, that it looked good, that it looked like it was the variant right from the start. And we continue to work with them closely. We are also increasing our surveillance across the state with CDC sequencing, in addition to the sequencing that we're doing here at the state lab.
So thank you all for joining us, Colorado and the world. I want to wish everyone a happy new year. 2021 is going to be a lot better than 2020, but for that to be a reality, we need to make sure that we're responsible over New Year's Eve and New Year, celebrate with the people we live with, or if you have a bubble of folks that have agreed not to associate with others, have fun at home, be safe, go sledding at midnight, whatever you want to do, but we want to avoid large gatherings and socializing. And if we get through this, this is our final major hurdle towards ending the pandemic, rapidly vaccinating more and more people and getting back to normal for a happy 2021. Thank you.